Hello, my name is Maria Simionato. I'm a 24-year-old student and full-time worker from Venice, Italy. And my connection with pulmonary arterial hypertension goes back to March 2005. I was 7 years old and a half, and I got diagnosed after an acute episode of fever and shortness of breath and so on. I was fortunate enough to get diagnosed right away. So I got sent to get an echocardiogram right away, and a doctor that goes by the name of Lucia Tessarotto, who I'll always be thankful for, basically told my parents right away what the disease was. And so after a couple of weeks, I got sent to Padua, which is one of the most renowned hospitals in Italy, I would say. I got right heart catheterism, and my diagnosis got confirmed. And luckily enough, I did respond well to nifedipine right away. I was fine and asymptomatic for most of my life, really. There is so much uncertainty and fear that comes with the diagnosis, obviously, because there isn't much that is known about this illness. And my parents were terrified and they didn't know what to do because in Padua, the doctors knew so very little. What they did back then was this is actually funny. There was no internet at that time. There was no info line. My dad, he cannot even speak English to this day. He ordered like some books from the internet that were entirely in English, and he would try to translate some infos. But eventually we did find some pulmonary hypertension specialists in Bologna, which is fortunately enough like an hour and a half drive from where we live. They've been taking care of me ever since. So by that point, I was, I think, 8 years old. I was luckily asymptomatic for most of my life. I would get sometimes like chest pains. I would get some shortness of breath. I was generally very lazy, all those kind of things that you would normally associate with pulmonary hypertension. I knew that I would not be able to have children. I could not do any sort of physical activity, but I was content with the life that I was living, really. I've always been very active as well. I've always worked. I kept up with my studies as well after high school. My situation, however, got worse in, I think it was September 2015. I was just like a month shy of my 18th birthday, really. So, what a lovely birthday present. Basically, I fainted. I was at school. So I got to the ER after a couple of hours. Then I went back to Bologna to get another right heart cath, and my pulmonary pressure got worse again. And so I got added Opsumit to my therapy. And I have to say that Opsumit helped tremendously. Like I had very little side effects. It was just a miraculous drug, really. I know it helped a lot of other patients as well. At that point, I was 18. I went back to living my normal life, finished high school, started university, started working. I now work for an insurance company. I was fine for most of my life until I wasn't. That's basically what happened. In January of this year, I did have this menstrual period that lasted for a month. I lost tons of blood. Basically, I did go to my gynecologist and everything was fine, really. He just told me that it was some sort of hormonal imbalance. It wasn't that big of a deal. Nothing was found that may have been, concerning. Then the last week of January, I suddenly could not get out of my bed. I could barely walk. My oxygen levels, my saturation was at an all-time low. My parents and I called an ambulance and I got sent to the ER. And obviously, what we thought would happen was getting some iron infusion because given the fact that I had lost lots of blood, my hemoglobin levels were again at an all-time low. Everyone thought that it was that sort of situation where we get like an iron infusion or maybe a blood transfusion. No one was concerned, not even my doctors in Bologna. I did go to the ER. I did get some blood transfusion. The doctors that were there at the ER were like, okay, given the fact that you have such a severe illness and you're taking these drugs, we're going to hospitalize you for tonight and see how it goes, but you should be fine overall. I had an oxygen level of saturation that was 84 out of 100, so I did have a small mask for oxygen, and I wanted to make it very clear that I had never had oxygen on in my life before. Like, I never needed it. I got an x-ray done, obviously, because, again, severe illness. They wanted to see if everything else was fine. My lungs were white. I remember a pneumologist came in saying they thought I had pneumonia, obviously. At first, they thought it was COVID, but they got some rapid tests done, and I was negative. Also, I did not have any other symptoms as well. So I got sent right away to the intensive care unit. I spent a couple of days there, wearing a non-invasive oxygen mask, also CPAP, and all sorts of masks, really. Apparently, what happened during those 5 days is that pneumonia was fading, apparently. I had all kind of drugs on. I don't really know. I was hallucinating for most of the time, I think. After 5 or 6 days, it seemed that the situation was going slightly better. But at the same time, I no longer had this pneumonia, but my blood oxygen level, my gas exchanges, my saturation were awful. I was wearing oxygen and I would probably saturate around roughly 75 out of 100. So I remember that each time I would even try to sit, I would just grasp for breath. And I was obviously terrified. But apparently, this pneumonia was going away. Everyone, even the doctors, were like, maybe it's fine. It wasn't. I was sent to a sub-intensive care unit, which is halfway through an intensive care unit and a normal hospital bed here in Italy. And I spent a week there. February the 12th came around, which I like to recall as the worst day of my life for me and for everyone that cares about me. At midnight, again, my saturation level were awful. I was not breathing at all. And so I got sent back into an intensive care unit. That was the first time I actually feared for my life, really, because I did not understand what was going on. They kept telling me that there was this pneumonia, but this pneumonia apparently was going away. So I was just like, okay, this is it. This is pulmonary hypertension finally killing me. On the morning of February the 12th, my doctors came in and they told me that I was going to be sent to Padua. Padua, of course, is a much more renowned hospital again than the one in the city that I live in. They told me I was going to be sedated, intubated, and then eventually they would try all sorts of drugs on me, anything that would work against pulmonary hypertension. That's the first time I actually, heard about the word double lung transplant. Of course, I've heard of it, but I was never fully aware of what that entailed as a whole. And so I was terrified. And the funny part about it is that I don't remember a single thing about that day because I was so out of it and probably of the anesthesia that I was given later on. Pretty much everything has been deleted from my brain. They told me that I was going to Padua, where lung transplanted surgeries are performed. Again, I don't remember much, but I remember that I signed the paper where I was giving them the permission to perform such surgery. And then it's just nothing for 2 weeks. But basically, what happened, I said goodbye to my parents, which was awful. What happened in the meantime? So I was brought to Padua in an ambulance. I was put under ECMO. And obviously, ECMO is highly dangerous and highly invasive. You're at risk for infection. If I had gotten an infection at that point, I would have been eligible for the lung transplant and I would have died. I'm just going to straight up say it. Basically, I got there on Saturday, February the 12th at night, and the following day, they tried all sorts of drugs on me, but my pulmonary pressure were reaching like its peak of like 150. I'm not joking you, nothing was working at all. So on Wednesday, February the 6th, I got put in the list for an emergency double lung transplant. Thankfully, my body was fine. I could get the transplant. I had nothing else going on. So, I was fortunate enough to get one. I don't think I'll ever stop saying this in my life. That was a miracle, really. That was February the 16th again. And then February the 19th came. And at 6 a.m. in the morning, the doctors called my parents and told me that a nice pair of lungs had arrived and I was getting prepped for the surgery. So I got into the surgery room at around 7 p.m. and I got out of it like 8 hours later. And the surgery went smoothly. I would like to thank also the surgeon who is brilliant, one of the best in the world that did the transplant, which is Dr. Andrea Dell'Amore. And then I woke up a week later. This is the fun part. I don't remember anything at all. I had remifentanil on, which is like 100 times stronger than morphine. So I did have like trouble understanding what had happened. And it took me like 4 days to understand that I had a double lung transplant. I remember that I woke up, I could not speak. I lost like 30 pounds or something. I was a petite woman before, so I was like a skeleton, really. From then on, things got slowly better. After a week, I got sent to a normal hospital room and I started breathing on my own. I started walking again. It took me a while to get back on my feet. Given the fact that I was also sedated for 2 weeks, I had like paralysis on one feet, which was interesting. It has now gone back to normal. But of course, I had all sorts of physical consequences as my body has been through an insane amount of physical trauma. I stopped taking Opsumit and ifetropion after 72 years of my life. I mean, this is the part of the story where everything gets good and it's actually kind of harder to talk about it. Here's the thing. Living as a transplant patient is not an easy job, obviously, because you're always fearing rejection in the back of your head. The drugs that you're taking, the immunosuppressants, are not easy on your body. All the physical and psychological trauma that you have gone through, because if you reach a point where you need an organ transplant in your life, you've obviously been through a lot. But I feel so much incredibly better now. I had an enlarged right heart because of pulmonary arterial hypertension, and now it has gotten back to normal. My heartbeat has slowed down. I have a perfectly fine heart now. My lungs are doing fine. And so I got sent home on April the 1st after exactly 2 months in the hospital. I have since gone back to get my checkup. I still have a little bit of rejection, as in, it's taking its sweet time to get the therapy right and so on. But I'm feeling better than ever, even psychologically, because I never once thought that I would heal from this thing. I thought I was going to die from it. I thought all sorts of things, really. And I didn't. I went back to visit also my doctors in Bologna because I got the surgery done in Padua, but my original doctors are still in Bologna. And when they told me that I didn't need to go back to them because they consider me as someone that has healed from this thing, I don't know, I feel like, I've died and was born again, really. It's just been insane. And it's been now 4 months and a half. And of course, it hasn't been easy. I've cried a lot and it's been intense for everyone, my parents especially. My parents are still out of it, really. I feel so incredibly fortunate and blessed. I never thought that I would live a life without this illness. And now that it's not here anymore. I mean, it's still part of me and of my identity, of course, but I'm still trying to find out what to do next and what to expect, really, because I'm so relieved, but obviously it's so hard as well, And I've gone back to doing physical activity. I've gone back to running, all sorts of things, really. It's just this massive weight has been lifted off my shoulders, really. And I'm just trying to be happy, really. I'm not asking for the moon, obviously, but I just want to live a life where I feel healthy and content with what I am and with the gift that I've received, because this has been a miracle, I do remember that when I got diagnosed, not many doctors would have perhaps believed that I was gonna survive long term. And now it's been 17 years and I'm here and I'm doing great. And of course, I do sometimes wish things had been different. I wish that life had been kinder. But overall, I'm just very happy with the person that I am, despite everything that I've been through. And I don't know what's coming next. I feel like after having a near-death experience at 24, you're thinking about the future, but you're also not, because obviously you just start appreciating all the small things and everything. But I'm just glad that I'm still here. And I had such a hard time accepting this disease, obviously. But now, having had the experience that I went through, I think helping others understand and get through these things will be the main goal, really. I'm a psychology student. I'm about to graduate as well, and I would love to do my final thesis also on psychological consequences of this awful disease and so on, because I may be cured again, but this is still part of me. I'm on the other side of it. I would just love to, just give like a little bit of relief to other people that might be waiting for lungs or maybe struggling with the disease, because I feel that's what I do. This is what's next, I think. My name is Maria Simionato, and I'm aware that I'm rare.